Hello everyone, my name is Heidi Barber and I am the Feet Farm Manager. In today's video series we're going to be discussing sheep and goat health, and we'll be going through several different tasks, talking about them beforehand and then actually demonstrating the task using our sheep here at our place. In this segment we're going to be talking about sheep and goat health. So I have up here a few things pictured that will most likely end up in your little vet kit as you purchase your animals. Some antibiotics, which should be under veterinary direction. Vaccinations, ear tags, a lamb pooler, lamb kid pooler, OB gloves, ear tagger, bottle for bottle feeding, and drench gun. One of the things to kind of keep in mind is a healthy flock is an important goal in a productive sheep or goat operation. Preventing health problems generally is easier and more cost efficient than treating unhealthy or diseased animals. Components of the flock health program include adequate nutrition, good sanitation, vaccination program, and parasite control regimen. As we go through the different segments, we'll be talking a little bit about each of these. And you'll see that some of them have overlap into other areas of the segments just because they all tend to work together to maintain a healthy flock. Even with a health program in place, you may still have health problems, but generally the economic impacts will be greatly reduced. So what I want to do now is talk about a few of the common diseases of sheep and goats, and this will be prevalent throughout no matter where you're at in the world. You will most likely see some form of these. Again, work with a veterinarian as they know what is prevalent in your location, as you may have these to worry about plus a few additional items, and that goes by climate, your region, your seasons, that kind of thing, as to whether or not those other items will be present in your area or not. The first one is Toxoplasmosis. This causes abortion in ewes and does. It is a protozoan and it causes coccidiosis, typically found in cats. What happens? It causes embryonic death and reabsorption if infected within the first 2 months of gestation. Your best mode of prevention on this is keeping your cat populations to a minimal and feeding medicated feed that contains rimicin or decox. There is not a vaccine available for this disease. Cassius Lymphatis. It is an infectious contagious disease. Typically affects the lymphatic system, although other organs may be affected. It's caused by bacteria, and the infection results in abscesses in the lymph nodes. And those, if it's in the lymph nodes, typically you will notice them because you'll notice the big swelling wherever the lymph node is that's infected, unless it's one of the deep internal lymph nodes. If it spreads internally, the affected animal will slowly lose weight and become emaciated. Vaccine is available for this, although most people don't vaccinate with it unless they've had CL on the property. Typical reason for this is because once you vaccinate an animal for CL, it will test positive from there on out. Next up is Enerotoxemia Type C and D. Type C is a hemorrhagic variety. It causes bloody scours. This one will typically affect newborns up to about 1 month old. Basically what happens is they get a bloody infection of the small intestine. It's usually brought on by a sudden change in feed or sudden increase in the milk supply, which you typically will see on your does or ewes, as from the time of birth until a couple weeks after, the milk supply is increasing before it starts leveling off and then decreasing. You can vaccinate the user dose 30 days prior to help prevent with the CDT vaccine. Enerotoxemia Type D, otherwise known as overeating disease, and one that most folks have probably heard about. It typically strikes the largest, fastest growing lambs in the flock, anywhere from 1 month old and older. What happens is the organism is already present in the lamb's gut, and if you have a sudden change in feed, typically what will happen is it'll allow the organism to proliferate to the point that it causes a toxic reaction. A little bit is good, too much becomes toxic to them. Typically what happens is you'll have a sudden death. Be fine, all of a sudden they're out there dead. But it can be chronic in nature. Again, vaccinating user dose 3 days prior to birth helps prevent. And the way it's helping prevent is as the lambs are getting the milk from the moms, they're getting the passive antibody transfer. John's disease, it's a disease that affects the intestines of mostly ruminants. Most commonly observed in dairy cows, but it can also affect your beef cattle, sheep, and goats. It's caused by a bacteria, and the strains that affect the sheep is different from the one that affects cows. In sheep, typically it presents more as a wasting disease, and there is a test you can send in for, but it's not necessarily reliable to see if they actually have John's disease, and there is no vaccine available in the U.S. Bovine progressive pneumonia, it's a slow developing viral disease. It's typically, you'll notice weight loss, progressive weight loss, difficulty in breathing, and development of lameness, paralysis, and hard bag. There is no treatment for it, but it can be eliminated from the herd using annual blood testing and removal of positive animals and removal of lambs from the ewes prior to suckling. Estimated that 50% of the flocks in the U.S. are infected with the ovine progressive pneumonia, and most of them do not show any signs or symptoms, which is why, unless you're doing testing, it's going to be hard to detect it because there's no actual signs and symptoms being displayed. And then mastitis, it's an infection of the mammary gland, which is caused by bacteria, and it's typically because of having unsanitary living conditions for the animals. You have acute and chronic mastitis. In acute mastitis, the udder will be discolored and dark, swollen, and very warm. In fact, you may be reluctant to walk. They may hold up one rear foot because they're trying to shift where it's comfortable. And most typically what you'll notice is they may be trying to kick the lambs off and not allowing them to nurse. User dose of chronic mastitis often go undetected. There are no drugs approved for sheep. You need veterinary assistance with this. Typically what it'll include is intramanary infused antibiotics, systemic antibiotics, and anti-inflammatory drugs. There is no vaccine for this. Good management and sanitation helps prevent the mastitis. Your heavy milkers are more prone to getting mastitis, but there's also a genetic component. And you may hear older producers say if they get mastitis, go ahead and cull them from the herd, and it's just because of that potential for the genetic component. And you have tetanus, which is caused by a Clostridium, and this disease is related typically to docking and castrating by elaster bands, although any wound can harbor the tetanus organisms. Signs will usually occur from about 4 days to 3 weeks or longer after infection is established in the wound. Treatment consists of anastomosis and antibiotics, although usually unrewarding, and typically you'll lose the animal. There is a vaccine available, given at time of docking, castrating, and is part of a preventative vaccine schedule. Last thing is bloat, and this is just excessive accumulation of gas within the rumen. If not relieved, it becomes severe and can cause compression of the heart and lungs and lead to death. You have frothy bloat and free gas bloat. Frothy bloat occurs in animals typically grazing lush pastures. To help prevent this, you minimize the amount of time exposed to the pasture each day. You can also put out hay for them to eat, which will help with breaking up the and slowing down the actual intake of the protein-rich feed stuff. Free gas bloat typically occurs with consumption of high concentrate feed that have not adapted to eating a grain-rich diet. And what it does, it causes a drop in the pH in the rumen and causes it not to be able to move, and which interferes with the normal gas release.